Sore throat and pain in the throat has become such a common complaint in a lot of patients that they are visiting the ENT surgeon. Today we are going to discuss this particular problem in little more. I am Dr. Ram Babu, Senior Consultant ENT Surgeon, Apollo Hospital, Jubilee Hills. Sore throat or throat pain, it's also called as the pharyngitis in medical terminology, is a very common complaint that we come across. Many people of different age groups keep seeing us for this problem, and they have a common complaint that this is coming back again and again. Frequently we are having this problem. In spite of taking treatment, this problem is not going away. This is the common complaint that we come across. So what is this throat, sore throat, what is this throat infection? See, structurally we have a throat where we swallow basically our water and food material, and also we have a larynx, that is the speaking area, that is the voice box, and we have a food pipe which is starting in the throat, which takes the food, that is water or food, into the stomach. So basically this throat comprises of all these delicate structures which can be subject to issues by what we eat and drink. So most of the problems can come from these two sources. Other than this, throat is also exposed to the atmosphere, environment, from where a lot of viruses or bacteria can attack the delicate structures in the throat. Very commonly that we find that whenever there is a seasonal change, or a water change or a food change, they have sudden feeling of rawness in the throat, and they have this constant hawking sensation. Clearing of the throat is a very common complaint, and sometimes it is associated with pain of varying grades, like very mild to moderate to severe pain also. So if we come across this particular problem, many times the home remedies can help us, like taking warm water or warm water with salt gargles, and keeping our diet and water in a proper restricted way. In 1 or 2 days, most of the complaints do subside and they will have relief. But if this is getting repeated, I suggest that they better see a ENT doctor if they have any deeper problem. So these problems can be, especially in children, it can be the tonsil infection, which is very common. Tonsils are the two structures in the throat, in the beginning of the throat. They have a lymphoid tissue, which means that they sample whatever it is going inside of any foreign material or microorganisms like virus and bacteria, and in turn they get infected. So whenever there is a tonsil infection, there is infection in the deeper layers, there can be pus formation, and there can be severe pain associated with fever. Other than this, they have a sensitive mucosa where the common things also can affect them. So I would suggest that they have to observe what are the common things that they are getting affected with. For example, if they take some sour items or too spicy foods or anything that it doesn't match with their throat, whenever they have coming in contact with that, they have the sore throat, probably they can do a preventive steps. The other common things that we are finding out in the recurrent or the frequent sore throat is the reflux problem, what is called as the gastric problem, the acidity issues which come up into the throat, which is called as the reflux acidity. This is the very common incidence nowadays of the youth as well as the middle-aged people, because of the number of factors which are related to the diet as well as the stress conditions. What exactly happens in these problem is whenever there is a disturbance in the stomach, like an indigestion or a hyperacidity or whichever doesn't match the digestive system, they have more acid production, and this acid can come into the throat and disturb their sensitive areas of the throat by giving a constant irritation and sometimes a very severe pain also, and they also have difficulty in swallowing. So these people need to attend to whatever they are taking and observe whenever it is getting repeated, like water or food. My simple suggestion is that they should follow a normal diet and a average diet like without any extremes of things like spicy food or too much of sour or sweet. Extremes should be avoided, and they should consume a lot of water to reduce the acidity issues. And if it still continues, probably they need to get investigated to check if there is any severe acidity problems. So overall, throat pain, though it is a very common thing, can be identified by simple observation and can be avoided by taking precautions. Thank you.